हमेशा खुश रहो बिटिया। आई एम JVN Dr. UPESH LIKHAR, Assistant Professor, Department of KRIYA SHARIR, Faculty of Ayurvedic Science, Jayoti Vidyapeeth, Women's University, Jaipur. Today we will discuss the next part of growth hormone. Regulation of growth hormone secretion. Hypothalamus and feedback mechanism play an important role in the regulation of growth hormone secretion. Growth hormone secretion is stimulated by hypoglycemia, fasting, starvation, exercise, stress and trauma, and initial stage of sleep. Whereas growth hormone secretion is inhibited by hyperglycemia, increase in free fatty acid in blood, and later stage of sleep. Hypothalamus regulates growth hormone secretion via three hormones. First, growth hormone releasing hormone. It increases the growth hormone secretion by stimulating the somatotropes of anterior pituitary. Second, growth hormone releasing polypeptide, which increases the release of growth hormone releasing hormone from hypothalamus and growth hormone from pituitary. And third, growth hormone inhibitory hormone or somatostatin, which decreases the growth hormone secretion. Somatostatin is also secreted by delta cells of islet of Langerhans in pancreas. These three hormones are transported from hypothalamus to anterior pituitary by hypothalamo-hypophyseal portal blood vessels. Hypothalamus regulates the secretion of growth hormones by negative feedback. Hypothalamus releases growth hormone releasing hormone and growth hormone releasing polypeptide, which in turn promote the release of growth hormone from anterior pituitary. And this growth hormone acts on various tissues and also activates the liver cells to secrete somatomedin C. Now the somatomedin C increases the release of growth hormone inhibitory hormone from hypothalamus. Growth hormone inhibitory hormone in turn inhibit the release of growth hormone from pituitary. Somatomedin also inhibits release of growth hormone releasing polypeptide from hypothalamus. It acts on pituitary directly and inhibits the secretion of growth hormone also. Growth hormone inhibits its own secretion by stimulating the release of growth hormone inhibitory hormone from hypothalamus. This type of feedback is called short loop feedback. Similarly, growth hormone releasing hormone inhibits its own release by short loop feedback control. Next, we will see applied physiology. Gigantism. Gigantism is the pituitary disorder characterized by excess growth of the body. The subjects look like the giants with average height of about 7 to 8 feet. Causes. Gigantism is due to hypersecretion of growth hormone in childhood or in pre-adult life before the fusion of epiphysis of bone with shaft. Hypersecretion of growth hormone is because of tumor of acidophil cell in the anterior pituitary. Sign and symptoms. General overgrowth of the person leads to the development of a huge stature with height of more than 7 or 8 feet. The limbs are disproportionately long. Such persons are hyperglycemic and they develop glycosuria and pituitary diabetes. Hyperglycemic causes constant stimulation of beta cells of islet of Langerhans in the pancreas and release of insulin. The overactivity of beta cells of Langerhans in pancreas leads to degeneration of these cells and deficiency of insulin. So ultimately diabetes mellitus is developed. Tumor of the pituitary gland itself causes constant headache. Pituitary tumor also causes visual disturbance. It compresses the lateral fibers of optic chiasma, leading to bitemporal hemianopia. Next is acromegaly. Acromegaly is the disorder characterized by the enlargement, thickening, and broadening of bones, particularly in the extremities of the body. Causes: acromegaly is due to hypersecretion of growth hormone in adults after the fusion of epiphysis with shaft of the bone. Hypersecretion of growth hormone is because of tumor of acidophil cell in the anterior pituitary. Sign and symptoms: first, acromegalic or gorilla face. Face with rough features such as protrusion of supraorbital ridges, broadening of nose, thickening of lips, thickening and wrinkling formation on forehead, and protrusion of lower jaw, which is called gorilla face. Enlargement of hands and feet. Third, kyphosis or extreme curvature of upper back thoracic spine. Thickening of scalp. Scalp is also thrown into folds or wrinkles like bulldog scalp. Overgrowth of body hair. Enlargement of visceral organs such as lungs, thymus, heart, liver and spleen. Hyperactivity of thyroid, parathyroid and adrenal glands. Hyperglycemia and glycosuria. Diabetes mellitus. Hypertension, headache and visual disturbance. Bitemporal hemianopia. Next is dwarfism. Dwarfism is a pituitary disorder in children characterized by stunted growth. Reduction in growth hormone secretion in infancy or early childhood causes dwarfism. It occurs because of: first, tumor of chromophobes; second, deficiency of growth hormone releasing hormone which is secreted by hypothalamus; third, deficiency of somatomedin C; fourth, atrophy or degeneration of acidophilic cells in the anterior pituitary; and fifth, panhypopituitarism. In this condition, there is reduction in the secretion of all the hormones of anterior pituitary gland. This type of dwarfism is associated with other symptoms due to the deficiency of other anterior pituitary hormones. Sign and symptoms. Primary symptoms of hypopituitarism in children is the stunted skeletal growth. The maximum height of anterior pituitary dwarf at the adult age is only about 3 feet, but the proportions of different parts of the body are almost normal. Only the head becomes slightly larger in relation to the body. Pituitary dwarfs do not show any deformity and their mental activity is normal with no mental retardation. Reproductive function is not affected if there is only growth hormone deficiency. However, during panhypopituitarism, the dwarfs do not obtain puberty due to the deficiency of gonadotropic hormone. Acromicria. Acromicria is a rare disease in adults characterized by the atrophy of the extremities of the body. Causes: deficiency of growth hormone in adults causes acromicria. The secretion of growth hormone decreases by: first, deficiency of growth hormone releasing hormone from hypothalamus; second, atrophy or degeneration of acidophilic cells in the anterior pituitary; third, tumor of chromophobes; and fourth, panhypopituitarism. Sign and symptoms: atrophy and thinning of extremities of the body are the major symptoms in acromicria. Acromicria is mostly associated with hypothyroidism. Hyposecretion of adrenocortical hormones are also is common in acromicria. The person becomes lethargic and obese, and there is loss of sexual function also. We end the last part of growth hormone, in which we studied regulation of secretion of growth hormone and applied physiology of growth hormone. In applied physiology, we studied disorder due to hypersecretion and disorder due to hyposecretion of growth hormone. This session is powered by Digital Version 2.0 Jyoti Vidyapeeth Women's University, Jaipur. Hope you are satisfied with my digital session. If you have any query, please mention it in comment box. I will resolve it. Thank you.